Hello guys, welcome back to Ophthalmology on the Go. Today we are going to study the Lincoff Rules, which are rules which help us identify the location of the primary breaks in cases of a retinal detachment. So first, we look at these six diagrams which have a diagrammatic representation, the retinal diagrams for the Lincoff Rules. We'll go through the legend first. We need to understand that the optic disc in these diagrams is represented as a brown circle, which is the center of the retina here for the sake of understanding. The detached retina is shaded in the color blue and the attached retina is shaded in the color red, and uh, the retinal breaks are shown in this way, right, where the outer circle is red in color and inside it is shaded as blue. Okay, so we'll just go through all these six diagrams first, and then I will tell you how I have simplified it and how it is easier to remember all of these rules. So, coming to figure A, we'll consider this as the 12 o'clock meridian and this as the 6 o'clock meridian. We can see that the inferior part of the retina is shaded as blue, which means that there is an inferior retinal detachment here. So, when there is an inferior retinal detachment with equal SRF uh, levels on both sides of the optic disc, the primary retinal break will be inferiorly located, that is at the 6 o'clock position. Now coming to diagram B, when there is a shallow inferior retinal detachment in which the SRF is slightly higher on one side than the other, then the location of the break is at the inferior margin only, but towards the side where the SRF is at a higher level. Okay. Coming to the third diagram, which is diagram C. When there is a bullous inferior retinal detachment, the bullous retinal detachment is represented with this, right? This thing represents that it is a bullous retinal detachment. So when there is an inferior retinal detachment which is bullous in nature, when it is bullous in nature, then the primary break will usually exist above the horizontal meridian. So the break is at the horizontal meridian, and there is a narrow passage or a guttering that is caused, and the SRF is draining down like this and causing a bullous retinal detachment. Coming to diagram D. In diagram D, we see that there is a diffuse retinal rhegmatogenous retinal detachment with a superior attached wedge area from the optic disc to the ora serrata. So this superior wedge is attached. So in this case, because the primary retinal break is located at the upper nasal quadrant, here the SRF will revolve around the optic disc and then rise on the temporal side until it is at the same level as the primary retinal break level. In these cases, just to simplify this one diagram, I will explain one important thing, that when there is a retinal break, the SRF usually moves from the area of the break towards the ora serrata, and then it starts moving backwards towards the optic disc. So the SRF here around the retinal break has moved to the ora serrata and comes back towards the optic disc. And once it has filled all this area, then it moves from below the optic disc and crosses over to the other side. This area is covered, and the SRF will stop at the point where the level of the retinal break and the level of the SRF on the other side are equal. Okay, that is one pathophysiology that we need to understand. So that is diagram D. Coming to diagram E, if there is a subtotal rhegmatogenous retinal detachment with a superior wedge attachment of the retina which is not connecting to the optic disc and the ora serrata as we saw here, right? It is not connecting. So just superiorly wedge-shaped area is there of the retina which is attached. So in this case, the primary retinal break will locate in the periphery nearest to its highest border. So whichever side of the border of the SRF is the highest, on that side the break will be present on the superior side. Coming to diagram F, a diffuse rhegmatogenous retinal detachment with inferior attached wedge retina from the optic disc to the ora serrata. So this is just the exact as the diagram D, but opposite. So here we have the inferior retina that is at wedge shape that is attached from the optic disc to the ora serrata. In these cases, when the SRF crosses from the vertical midline above, the primary retinal break is usually at the 12 o'clock position. The lower edge of the rhegmatogenous retinal detachment corresponds to the side of the retinal break. So if this is the lowermost edge, even if it is we locate the retinal break superiorly, but it will be more on the side where the SRF is lowest, right? So it will be around this region, right? Okay, so this was the Lincoff rules. So now I will just simplify the Lincoff rules for you all. There are a lot of things to remember in Lincoff rules, but if you understand how to actually apply it in practice, it will be easier to remember. So imagine that you're in the OPD setting and looking at a person's retina through an indirect ophthalmoscope. First thing you have to figure out if it is your retinal detachment is a superior retinal detachment or an inferior retinal detachment. Okay, so if there is a superior retinal detachment that you have seen, then try to assess if the superior retinal detachment has crossed over the 12 o'clock meridian or not. If the superior retinal detachment has crossed over the 12 o'clock meridian, then the position of the break will be around 1.5 clock hours of the 12 o'clock meridian, right? So at 12 o'clock meridian, 1.5 hours around that is the position of the retinal break if your retinal detachment and is superior and is crossing the 12 o'clock meridian. Second situation, if you have a superior retinal detachment which is not crossing the 12 o'clock meridian, then the break is going to be within 1.5 hours of the superiormost edge of the retinal detachment. This was for superior retinal detachment. Now, imagine seeing an inferior retinal detachment. In the inferior retinal detachment, the two sides of the subretinal fluid on both sides of the optic disc, if the level of the SRF on both sides of the optic disc is the same, then the break is located at 6 o'clock position. But if one side is higher than the other, then the break is located in the inferior quadrant only, but towards the side of the higher level of the SRF. Correct? Third situation for inferior retinal detachment, if you have an inferior bullous retinal detachment or an inferior detachment where you are not able to localize the break in the inferior quadrant, then there is a possibility that the break is located somewhere in the superior quadrant and there is a peripheral guttering that is originating from the break position towards the inferior retinal detachment and is draining the SRF that way. Correct? So we have two situations for superior and three situations for inferior retinal detachment. So this flowchart is what summarizes the actual application of the Lincoff rules. If you want, just take a screenshot. I have tried my best to simplify this as much as possible. If you have any doubts, please leave them in the comment section. If you wish for me to simplify it even more, or if you have any questions or anything else that you want to ask, please leave a comment in the comment section and I will address it surely. And if you like the video, make sure you hit the like button, and please subscribe. And I hope you liked it, and I hope it was helpful. Thank you.